Insight. I am your host, Reverend Dr. Rodney Coles, bringing resource to the community. Please get your pen, your paper ready now because you're about to get a lot of great news today. I have a good friend here, have traveled down here, and my goodness, what a load of information she had to give you today. So I advise you, get your popcorns because this is going to be entertaining of things that are going to help you move forward. Today, I have Mrs. Peggy O'Connor with Care for Carolina. Welcome to the broadcast.
Pastor Coles, thank you so very much for inviting me to come. I drove all the way over from Farmville this morning.
That's a long ride. Now, Miss Peggy, you involved with so much. I gotta say, I met you through Reverend Bob Hudak, my friend and my brother, and the work. I had the pleasure being with you down in legislation building. You have a long resume. You know, you have one of those resumes that remind me of those yellow pages that we used to get in the house. They come out the door. You know, you use it for the children to
In
sit in
very
the chair.
small print, yeah.
But please tell us a little about Miss Peggy O'Connor.
All right, so I am a lawyer by profession and have been working in health advocacy for a long time here in North Carolina. And as you said, down at the General Assembly, working with members from here in Pitt County, from Greene, Lenoir, and all over the state, trying to get good health policy enacted for North Carolina. The reason that I'm here today to talk with you is to talk about closing the health insurance coverage gap in North Carolina and what that means to the people of Pitt County and Greene County and Lenoir County, as well as people across the state. What we can do to make our lives healthier, what we can do to make our economy healthier, and what we can do to give people economic security. So I am the chair of a group called Care for Carolina. That's CARE, C-A-R-E, number 4, Carolina. And you can learn more about us to find out that we are truly legit at careforcarolina.com. And people can look at that anytime. It's a wealth of resources and really gives you a picture of who we are and what we're working for. We are a statewide coalition of 157 organizations. Wow. Now, that's not 157 people. That's 157 organizations representing millions of North Carolinians. For instance, the American Heart Association, the American Cancer Society, the North Carolina Nurses Association, the VFW, any big organization that cares about health policy, the Medical Society, the Hospital Association, they're all part of Care for Carolina, working to get the coverage gap closed, to expand Medicaid in our state so that we can benefit our rural communities as well as our urban communities. And one of our best partners and one of our founding partners is the North Carolina Rural Center. And I know that in Pitt County isn't as rural as it used to be, but when you get over toward Farmville it is. But the Rural Center has been at the table from the beginning, and we'll talk a little bit more, I think, about how closing the coverage gap through Medicaid expansion can actually benefit our rural communities.
You know, that's so important of closing that gap, and I know that we're not political people. We just want to be nonpartisan, but we want to let them know how important it is on closing that gap because that gap right there stopped them from getting the care that they need. And in 1960, they did a pilot program with food stamps because they knew of the hunger. In 1970, it got approved. Explain a little bit more about that gap that is messing us all up.
So back in 2010, the Affordable Care Act was passed, and the hope was that it would help people in North Carolina and across the nation get access to health insurance. So what they did was they created the federal marketplace where people could get subsidies and with small premiums get decent health insurance. These are people who didn't have any health insurance. And the hope was that the states would expand their Medicaid programs up to a certain poverty level so that people would be covered. People who didn't have insurance through their job weren't covered by Medicare, like I am now. I've been working on this issue such a long time. Now I'm on Medicare. Well, so that was all good, and the hope was that we would actually be able to see almost a fully insured population in the United States of America. in 2012, the Supreme Court, while saying the Affordable Care Act was constitutional, struck down the mandate that states expand their Medicaid program, which is what's created the coverage gap. In North Carolina, we've got 600,000 of our brothers and sisters, our neighbors, our friends, who are stuck in a place where they this makes me crazy, Pastor Coles, every time I say this, who make too much for Medicaid, but make too little to get a subsidy on the Affordable Care Act. So these people are literally stuck in the middle with no way to buy any kind of health insurance. And we know when people don't have access to health insurance, they delay care, they put it off until it's an emergency situation, then they end up in the emergency room, sometimes with a stage 4 cancer diagnosis. And the emergency room they will do what they can for you, but that's if you could have had a routine screening, then the person might live. But when a stage 4 diagnosis is given in the emergency room, it's never going to be a good outcome.
And that's really sad to know that these things happen, and that you could get to that point that you can't look at your health care. Most people still got to work, or if they're not working, they rather work. They might wait until something happens before they go to the health care. Most men end up finding that they have prostate cancer and they're at stage 4. It's too late.
It's absolutely
It's too late because they didn't have insurance. I mean, first thing, it takes men. I'm just going to speak for me. Maybe I don't want to get beat up later. But us men are the most stubborn people in the world.
I will not disagree with you.
So to get us to go to the health care, sometimes it's hard, but it make it easier if we had that ability to be able to go. The same way we monitor and tune up the vehicle and air tire pressure and oil change, that's the same thing with our body.
Right.
But we don't have it, it delays, and you can't afford to go to health care. You can't afford to even get the medicine that you may need. We travel into a zone where we start as children. My grandma used to say once a man but twice a child. Yes, and we come from that child to a man, then back to the child. And at the beginning we needed it, and we still need it now. And we have to be able to have this to help us to move forward in our daily life, because most of us first time we're going to pass away from something. We all die, but the question is, there's some things you could prevent. And if we had that would help us so much.
Well, and it would improve the quality of life in North Carolina. So North Carolina, and especially the eastern part of North Carolina, is not as healthy as it could be. I mean, we have wonderful hospitals. Vidant and ECU are down here, and they are doing the Lord's work, literally, in taking care of patients, in working with the smaller hospitals that are surrounding to make sure people have the ability to get care. But if people don't have the ability to pay for it, they're not going to do it early until it's an acute situation. And in the East, I mean, this is something I've been passionate about for years. We live in the middle of the stroke belt in the eastern part of North Carolina. And what that means is we have more strokes in eastern North Carolina than we have in western North Carolina or in the center part of North Carolina. But all of North Carolina has more strokes than people in the rest of the country. And so, stroke is something that if people have regular access to a physician, to primary care, and they perhaps have hypertension or they have diabetes, they see a doctor, they see a nurse practitioner, they see a PA, they get the medicine they need to manage the condition. And so let's just talk about blood pressure. You're talking about pills that cost 3 cents. Take that every day. Now, when you go to the drugstore, they don't cost 3 cents, but they're fairly inexpensive. But if you don't get to see a doctor who can prescribe that pill for you and have insurance to cover that doctor's visit and that medicine, then you're probably not going to take advantage of that. But I will tell you this, one stroke in North Carolina will cost somebody, and mostly the taxpayers, whether it's through higher insurance rates or simply charity care, $500,000. So if you treat someone with high blood pressure for pennies a day, you can prevent a $500,000 stroke from occurring. And that's kind of where we are. I mean, you have people who are going to work every single day, and these are not layabouts. These are people who, if they were laying about, they'd stay home and get Medicaid. They're not. They're parents, they're farmers, they're firemen, they're pastors of small churches who don't have insurance with their job but don't make enough to get a subsidy. And so these are the people who are, during the pandemic, were the ones who kept our businesses open. These people work hard every day, and they have no ability to take care of themselves or their family.
And that is so sad. You even have those who are working at their job, they can't leave their job because whatever Medicaid they have, whatever medical benefits, and now in some states, won't call it out, but one state that I came from, they started to not give you Medicaid, giving you medical now, just paying you more money and expecting that you should be able to afford it, but you can't.
That's exactly right.
I mean, your Medicaid than your salary, basically, when you break it down. And you're right. And then also, maybe hope I don't hit an age discrimination. If these people can't leave these jobs because they have no way to take care of their health, because as we leave our jobs or whatever, even pastors, and our body is deteriorating every day, and there's things need to be checked out. I just stopped 40 days. I just stopped eating fried food now, and I'm trying my best. No fried chips, no potato chips, no of that. I had a snack attack. It's in the middle of the night. I'm going up front and look for the candy, but I haven't done that in 40 days. And so. Challenging myself.
I was going to say, in 40 days, there was a fellow that we've heard of who fasted for 40 days and 40 nights. So I hope you make it longer than that.
And I'm still pushing it. But I do go to the doctor, and it wasn't because I was blessed of medical. I mean, having insurance that I'm able to do, but still. Everybody's not as fortunate. I worked with last year we did 58,020 children in the eastern part of North Carolina, giving them toys per child. And majority of them doesn't have all these rural areas. They don't have the care for them, and they won't go to the dentist. They won't. We could go on.
Yeah, and I think, you with your Toys for Tots, which is a tremendous campaign, and my husband being a naval war hero, a Navy veteran, that's what he always supports the Marines. And Toys for Tots is such an important thing. And the fact that you move those toys at Christmas time out to those kids, maybe this year, in addition to that, we can give their parents some health and some access to health care. And, another thing, I mean, not only is this about individuals' health, it's about the health of our health care system. In states that have not, and North Carolina is one of the last 12 not to expand its Medicaid program. So in states that have not expanded, they've seen a huge number of rural hospitals close. And North Carolina, especially in the far west and the far east, have seen 6 hospitals close in the last 10 years, simply because they couldn't afford to stay open. They couldn't continue to deliver the charity care. That is not something you make up on volume. So again, one stroke, one heart attack, that's extremely expensive for a hospital to just write off. And when someone has no insurance, that's what they have to do. Or, and this is really a very sad thing, the facility will say, I'm so sorry, we have to try to collect this debt. And so what we are finding now is medical debt is the leading cause of bankruptcy in the United States of America, because you don't get a $50 bill and not pay it. You get a $500,000 bill and not be able to pay it. And so that is becoming more and more troubling. And what we've found through recent research, so this is just a fact, there are 3,000 counties in the United States of America. And each one of them, we did some research to find out how much medical debt. The 2 of the top 5 medical debt counties in the country are right here. Greene is number 2. They have the largest amount of medical debt per capita in Greene County. And right behind it, number 3 is Lenoir County. So, these are our friends. These are the people that we go to church with, and whose kids go to school with our kids. They they're working, trying to make a better life, and one illness can destroy them physically, and it can just destroy them financially. And we need to do something about that. And even our General Assembly, who's been hesitant to discuss the issue of Medicaid expansion for a number of years because they wanted to make sure that the dollars and cents added up. Both this House and the Senate this past year passed Medicaid expansion bills, saying, and you were there at the prayer breakfast we had when one of those things was happening. I mean, it was truly, truly a remarkable enlightenment for and change for our members of the General Assembly to say, yes, we need to do that. The problem and where we are now is the Senate has one version and the House has another. And so they have not come together yet to actually pass a law. And so while they wait and they maneuver, 600,000 people still don't have health insurance. They're still at risk for bankruptcy. The hospitals are still at risk for closing. And the amount, the fact that we're paying for it. I mean, your paycheck, well, I know you're retired too, but, for years, there was a surcharge on, if you look at your paycheck stub, if people still even get those things, and it says Medicare surcharge. Every North Carolinian who works is paying a small surcharge to fund Medicaid expansion, except we're not doing it here. So we're paying for Medicaid expansion in New York, which I know is your home state, and in my home state of Ohio, and California and Virginia. But the people of North Carolina who are paying for this are not getting it. And, that's just crazy 6 ways to Sunday. And we need to do something about it.
It's almost like you're paying for a meal, but you never received it.
Exactly.
And they're taking that out, and we need that for families. So with Care for Carolina, what do you guys do? I know what you do, but we got to let the audience know exactly what you guys do regarding this here.
So we're a statewide advocacy organization. We only do one thing. We're a not-for-profit, so we don't engage in politics, but we engage in issue advocacy. So we have been working it's almost been 10 years now. And I was not on Medicare when we started. To work with our state policymakers, the governor, to try to craft a plan that will close that gap, that will allow those 600,000 people to get access to health insurance. We've put together all kinds of research. We've put together talking points. We've gone across the state having community meetings where the people in the communities, whether it's a person who's in the gap, a small business owner, an economic development person, the healthcare community, they want this to get done because it's so important to the future of our state. So we're down at the General Assembly when the General Assembly's in session, advocating every day. And those 157 organizations that work with us, they communicate with all their members to say, talk to your legislator. Tell them what a good idea this is. Tell them North Carolina cannot afford to wait any longer. The health of our state, its economy is at stake. If we were to do this, the amount of money that would be generated because there is new money in the healthcare system would bring tax dollars to Pitt County or Greene County or Lenoir County or Martin County. It would bring jobs, more healthcare jobs, and then all the jobs that kind of come along behind those. So if you are able to employ more healthcare workers, then perhaps people who build houses will build a couple more houses. There'll be people who might build another facility. So it's an economic engine. It's a driver of our economic engine. And it would really impact down here, because Eastern North Carolina, once you get past Pitt County, it is until you get to New Hanover, is very, very rural. And 10 new jobs, I think the statistics for Greene County are like 54 new jobs. That's a lot of jobs. And for small towns like Farmville, that's a big deal. And the fact that the people in the community are secure in knowing that they can get preventative health care, and if they get sick, there's help for them. And they don't have to decide whether they're going to buy food or buy medicine, or they don't have to decide whether they're going to lose their house if they have a heart attack. So that's the case we make to our members of the General Assembly. And then we ask the citizens to communicate directly because all politics is local. Call your state legislator and say, please get this done for us.
And the question, how would somebody, if they want to be a part of your guys, is there a way to be a part of Care for Carolina?
There is indeed, and I thank you for asking. Care for Carolina, Carolina.com. That'll take you to the homepage of the website, and there at the top there is a button that says Act Now, and you can sign up as a business. You can sign up as an individual, and you will get an email once a week that'll tell you what's going on. If you put in your address and your zip code, we can connect you with your legislator when the time is right. You can join as a faith community. And tonight I'm going to make a pitch to a number of members of the faith community in Farmville at Emmanuel Episcopal Church. I'm going to talk about this issue and ask pastors and congregation members if they won't join with us. We've got over 200 faith communities, churches, dioceses, councils that are part of Care for Carolina. And so we want to bring the message down east.
Wow. As you're listening to Miss Peggy O'Connor speaking about the need to join on, this is your opportunity to say, well, what can I do to make a difference? A lot of us sometimes we talk a good fight. You say how you're going to knock them out the first round and you're going to do this and that. We all excited, but when the bell rings, you stay in the corner. And we don't need people standing in the corner. We need to hear the voices from our community. We need people that's connected with Care for Carolina. Join on, getting information, learn about your legislation. There's two things we need. We need education. You need to be educated, and that's what Ms. O'Connor is doing, educating you. And we also need legislation. You need them both. You can't have one without the other. And if you have folks that are fighting for us, this is very important. You may say, well, listen, it ain't happening to me, but it's happened to somebody in your family. And it's going to happen to somebody in your family, somebody you know. You might went to school with them. These are things that happen in the world today. This is not something we say, well, it may happen. It's happening now. People need help. Again, they need to go to the doctor, and there's so much needed. As she gave you the information, Care for Carolina, go into that website. .org. Go to that website and join on. And it's very important for us to join on to help these causes in our community. As Ms. Peggy, also I want to mention, if somebody wanted, they say, listen to this broadcast, they say, I would love Ms. Peggy O'Connor to come. I heard it on the broadcast, and I got to get this out, and I need to have you to speak to our people. I know you're speaking tonight at the Emmanuel in Farmville there with Reverend Hudak and I putting together a good forum, and they're so excited. They got that all on the news, been on the WITN news in the paper. So we just thanking God had God put it out, because even the news people know it's so important of this here. And if somebody said, well, how would you come to my church?
Wherever two are gathered, I would be there. And I have colleagues who, we have people in, I don't know that anybody in Macon County is going to hear this program, which is about as far west as you can get. But we've got colleagues in the West, volunteers in the West. We would be delighted to come and talk. And, being in Farmville, Pitt County and Greene County, Lenoir County, that's all right in the backyard. And Martin, I would be delighted to come to talk to a church congregation, to a civic group. It would be my honor to come and tell you about the number of veterans that are in the coverage gap, that the number of farmers that are in the coverage gap, the parents who are struggling to put food on the table for their children and can't afford to keep themselves healthy. And if we want a robust workforce, people need to be healthy. I mean, they can't be, suffering from congestive heart failure and trying to do a job. So we have a chance to make a real difference, and I would love to come and talk to people about it.
Well, Ms. Peggy, I just want to thank you for being on this broadcast. And just one more question. We are a nonprofit. Do we accept donations? Is the question.
Oh, Care for Carolina, you can. I would want to take any money from Clergy United, but if people feel strongly when you go to the website and want to act now, you can also donate to Care for Carolina. There's a button at the top, and your money would not be used for lobbying or anything inappropriate, but it would be used to spread the word across the state that the time is now to close the coverage gap in North Carolina, to expand our Medicaid program, to have our legislators do this and do it the right way to help the people of North Carolina live healthier, happier, more economically secure lives. So we would, if it's $5, that would be wonderful. If it's $500, that would be more wonderful. But we would be most honored that anyone would contribute to our cause.
Again, we thank Ms. Peggy O'Connor for being on the broadcast. Carolina is called careforcarolina.org. .com. I apologize. Careforcarolina.com. We need your help. A lot of information you receive. She will come and visit you. God bless, and we see you at the next broadcast.